Lethal pressure points, areas that can cause immediate death. In a life-threatening close combat situation, there are certain areas of the body that when targeted with the right amount of force, can lead to immediate death. These are the pressure points where damage is not just severe but fatal, and it's important to understand the risks involved. This is not about minor injury or incapacitation, this is about life or death. Here are the most lethal areas to target if your life is at risk. 1. Carotid artery, neck. The first area to understand is the carotid artery, which runs along the sides of the neck, just beneath the jawline. A blow or pressure to this artery can be lethal because it can disrupt blood flow to the brain. If you apply pressure here or strike with enough force, you can cause a rapid drop in blood pressure and asphyxiate the person, leading to unconsciousness or even death. This is why chokeholds targeting the carotid artery are so dangerous. When pressure is maintained, it can stop blood from reaching the brain, causing brain damage or cardiac arrest. 2. Cervical spine, neck vertebrae. Next, the cervical spine is a highly vulnerable area. The first two vertebrae, known as the C1 and C2, are critical. A forceful strike to the neck, especially targeting these vertebrae, can result in a severed spinal cord. This instantly disrupts communication between the brain and the body, leading to paralysis or instant death. Even minor trauma to the cervical spine can be fatal, as it controls essential functions like breathing. A quick strike or sudden twist to this area can easily cause death by respiratory failure. 3. Temples, sides of the head. Another lethal target is the temples on either side of the head, just above the ears. These are areas where the skull is thinner, and a strong impact can directly damage the brain. A punch or strike to the temples can cause brain hemorrhaging or swelling, which can lead to immediate death. Because the brain is so sensitive and the temples are so vulnerable, trauma to this region can be fatal almost instantly. 4. Jugular vein, neck. The jugular vein is another critical area. Located in the neck, the jugular carries blood from the brain back to the heart. A strike or pressure on the jugular can cause rapid blood loss, leading to death from hemorrhaging. If the vein is punctured or ruptured, it can cause shock and a massive loss of blood in a very short time, and without immediate medical intervention, this is fatal. 5. Femoral artery, groin. The femoral artery, located in the upper thigh near the groin, is one of the most dangerous blood vessels in the body. A strike here can cause massive blood loss because the femoral artery carries a large amount of blood to and from the legs. If this artery is ruptured, the individual can bleed out in a matter of minutes. This is a quick route to death, as the loss of so much blood can cause the person to go into shock and eventually die from exsanguination, or bleeding out. 6. Heart, chest area. Lastly, the heart is an obvious but lethal target. A powerful strike directly to the chest, particularly to the sternum, can cause the heart to stop beating. If enough force is applied, it can cause a heart attack or cardiac arrest. The heart, which is responsible for pumping blood throughout the body, is vital to survival, and any damage to it, such as trauma to the chest, can be fatal. When the heart stops, the brain and other organs are deprived of oxygen, leading to immediate death. Takeaways. Understanding these pressure points and their potential consequences is not for the purpose of harming others unnecessarily, but for recognizing the extreme risks involved in combat. These areas can cause death instantly if struck with sufficient force, and any engagement targeting them should be treated with the utmost caution and respect for the danger they pose. In any self-defense scenario, the goal should always be to escape, not fatal combat.